Hello everyone, welcome to our channel Learning Together. Today we are going to discuss a very important topic for nursing and medical and Lok Seva examination, that is pain management. In this video we will learn what pain is, different type of pain, pain assessment, pain skills, pharmacological and non-pharmacological management, nursing responsibilities, and finally we will solve important Lok Seva style multiple choice question. So watch the complete video and make sure you will remember the important exam point. Now we will discuss about the definition of the pain. First, let's understand the definition of pain. Pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. The most important point for examination is pain is subjective. This means the pain is experienced differently by different individual. For example, two patients with the same disease may report a completely different level of pain. Therefore, the medical person should not decide that the patient pain is insignificantly simple because the patient appear comfortable. The patient's own report is an important source of information when the can patient can communicate. Pain can affect many aspects of person's life, including sleep, appetite, mood, and daily activities. Therefore, effective pain management is an important responsibility of healthcare profession. Here, the exam tips is that pain is a subjective experience. Now we are going to discuss about the type of pain. Pain can classify in several ways. First, according to the duration, we are commonly discuss acute pain and chronic pain. Acute pain usually have a recent occasion and is commonly associated with injury, surgery, procedure, or actual illness. It generally serves as a warning signal that something is wrong. For example, pain following surgery or a fracture. Now, the second is chronic pain. Chronic pain persists or recurs over a prolonged period and may continue beyond the expected period of healing. For example, may include some form of chronic back pain or pain associated with long-term illness or condition. Now, let's uh, let's look at another classification: nociceptive pain. It results from activation of pain receptor due to actual or potential tissue injury. It can occur or include somatic and visceral pain. Somatic pain may arise from skin, muscles, bone, or joint. Visceral pain arise from internal organ and may be different to localize. Now next one is neuropathic pain. Neuropathic pain result from a lesion or a disease affecting the somatosensory nervous system. Patient may describe it as a burning, sooting, electric shock like or tingling pain. Remember these classification because they are frequently useful in nursing examination and other medical line examination. Acute acute pain, recent or short term pain, chronic pain, prolonged recurrent pain, nociceptic pain, tissue injury related pain, neuropathic pain, nervous system related pain. Now next one is pain assessment. Before treating patient, the nurse or medical person must first assess the patient pain. A pain, a complete pain assessment include several important components. First, ask the patient where is the pain. They will ask this. This tell us the location. When did it start? This give information about onset and duration. What does the pain feel like? The patient may describe it as a itching, burning, stabbing, or shooting. And how severe is the pain? This can be assessed using uh, an approximate pain scale. Also asks what make the pain worst, what make it the better. Does the pain affect sleep, motivation, eating, or daily activities? And a useful approach is to remember the mnemonics PQRST, where P denotes to the provocation, what makes the pain worse, and Q denotes to the quality, what does the pain feel like. R denote to the religion or radiation, where is the pain, does it spread somewhere else. S denote to the severity, how severe is the pain. T denote to the timing, when did it begin, is it constant or intermediate. This is an important assessment framework for the medical student. For the medical student, it is the important framework PQRST. Now next one we are going to discuss about the uh, pain skills. One of the most common method for the pain scale is the numeric rating scales. The patient may rate pain from 0 to 10. 0 generally means no pain, while 10 represent the worst pain imaginable. And another method is visual analog scale, where the pain intensity is represented along a line. For children or patients who have difficult in communication, an appropriate age or ability specific skill may be used. For a patient who cannot reliable self report, healthcare profession may use validate behavior or observation pain assessment tool. Remember remember the appropriate pain skills depend on the patient age, cognitive ability, communication ability, and clinical situation. The goal is not simple to obtain the number. The goal is to understand the patient pain and evaluate whether the treatment is helping or not. Here you should remember this. The 0 is represented as no pain, 10 is represented as worst pain. Now we are going to discuss about the pharmacological management. Pain medication are selected according to the types and severity of the pain, the patient condition, contraindication, and the prescribed treatment plan. Number 1 is non-opioid analgesic. Example include paracetamol and NSAID when appropriate. NSAID can be useful for the pain associated with inflammation, but nurse should be careful of the potential adverse effect and contraindication. 2 number opioid analgesic. Opioid may be used for the moderate to severe pain when clinically indicated. Example include medicines such as morphine and other prescribed opioids. An important nursing responsibility is monitoring for the adverse effect. The most important serious adverse effect effect to remember is re- respiratory depression. Other potential adverse effect including sedation, nausea, vomiting, constipation, and hypotension. Therefore, when opioid are administered, the nurse should monitor the patient level of consciousness, respiratory status, pain response, and other relevant clinical parameter. The third medication is the adjuvant medication. Certain medications that are not traditionally analgesic but may be used for partial type of pain. For example, some antidepressant and or anticonvulsant may have a role for for the management of neuropathic pain. The exact medication should always be selected and administered according to the clinical indication and prescribe. Remember that pain management should be individualized. The same medication is not appropriate for every patient. And for examination in the above point, you should remember that opioid one of the most important adverse effect is respiratory depression. Now we are going to discuss about the non-pharmacological pain management. Pain management does not always means giving a medication. Several non-pharmacological management or method can help to reduce the pain or improve the patient ability to cope the pain. In this, in this, um, this include the relaxation technique, distraction, positioning, heat or cold therapy, massage, psychological support, and multimodal pain management. Relaxation technique encouraging slow, control breathing and relax may reduce anxiety and muscle tension by the help of distraction, conversation, music, television, reading, or other suitable activity may help diverting attention from the pain. Positioning helping the patient finding a comfortable and supportive position so that discomfort or the pain can be reduced. Heat or cold therapy, these may be useful in selecting condition, but they must be used appropriately to avoid skin injury. Massage, when appropriate and not contraindicated, massage may promote relaxation and comfort. Psychological support, anxiety and fear can increase the perception of pain. Therapeutic communication and reassurance can therefore be valuable. The important concept is multimodal pain management. This means using appropriate combination and a combination of pharmacological and non-pharmacological approach rather than depending on one and other. This is the important thing. Now we are going to discuss about the nursing responsibility. What are the important nursing responsibility? First, assess the patient pain. Second, document the assessment accurately. Third, administer prescribe analgesics safely. Fourth, monitor therapeutic response and adverse effect. Fifth, reassurance the pain after the intervention to determine whether it was effective. Sixth, use appropriate non-pharmacological intervention when indicated. Seventh, educate the patient about the treatment plan and encourage the patient to report uncontrolled pain. And finally, communicate a significant change in the patient condition to appropriate health care profession. We should always remember that assessment, intervention, reassessment, and documentation. Now, the important part, looks a practice question. Try to answer each question before the answer appear. Question number 1. Patient is sorry. Question number 1. Patient is best described as, sorry, pain is described as, what do you think? In my opinion, pain is described as a subjective sensory or and emotional experience. Answer number B. This is right or not? Yeah. Question number 2. On a 0 to 10 numeric pain scale, 0 generalized indicate it is simple, no pain. Question number 3. Which of the following is an important adverse effect of opioid analgesic? It is also the simple. Answer number A. Respiratory depression. Question number 4. Which of the following is an non-pharmacological method of pain management? Question number A. Relaxation. Which mnemonics can help to assess important aspect of the pain? PQRST. And question number 6. Which type of pain is associated with damage or tissue or disease affecting the nervous system? Question number A. Answer number A. Neuropathic pain. Question number 7. The first important step in effective pain management is answer number B, assessing the pain. Question number 8, which statement about pain is correct? Question number C, pain is a subjective statement. Question number 9, which intervention can be used as a non-pharmacological approach to pain management? Answer number A, appropriate positioning. Question number 10, after administering an analgesic, the nurse should reassess the patient response. Now the final revision. Before we finished, let's revise the important point. Number 1, pain is a subjective. Number 2, pain should be systematically assessed. Number 3, PQRST is a useful framework for pain management or pain assessment. Number 4, a 0 to 10 numeric scale commonly use 0 for no pain and 10 for the worst pain. Number 5, opioid can cause serious adverse effect, especially respiratory depression. Number 6, pain can manage by using both pharmacological and non-pharmacological approach. Number 7, assessment, intervention, reassessment and documentation. Uh, these are important concepts for nursing and Lok Seva examination. Thank you for watching the video. Keep studying, keep practicing MCQ questions, and all the best for your examination. Namaste and see you in my next class. And please don't forget to share, subscribe and follow.